Well, the first thing is we have to start thinking in terms of health, not just health care. And let me explain. Our whole system is upside down, and the reason that it's broken is because we really don't have a health care system in America. We got a sick care system in America. We put all the focus on disease and the treatment, not on the prevention. And because we've done that, now we spend 80% of our health care expenditures on the treatment of chronic disease. 80%. Which means we mostly are paying for overeating, underexercising, and smoking, the three behaviors that drive most chronic disease. From the way we train medical students, which is not to treat or train doctors how to prevent disease, but we train them to prevent it. The average medical student gets 211 minutes on dealing with diabetes, yet it's the #1 problem that a doctor is going to face today in his medical practice. Our insurance policies, they pay to treat catastrophic diseases. They don't treat or prevent anything. If you have a quadruple bypass, you'll be covered. You probably have very little out of pocket for that. If you want to see a nutrition counselor so you can lose weight, start eating healthy, and maybe go to a gym and work out and actually prevent all those diseases, including the quadruple bypass, you're on your own. Now, that doesn't make any sense at all. I mean, the system is upside down, so it's all backloaded on the expense side instead of front-loaded on the prevention side. And that's the first thing that needs to change, is a cultural shift from a sick care to a health care. Build the incentives in. We did a number of things in Arkansas and got a lot of national recognition for things like discounting health policies for people that did health risk assessments and didn't smoke. We gave people walk breaks instead of smoke breaks. We gave people points for healthy behaviors where they got what we would call well leave rather than sick leave. If you think about it, our system from an employer's side is all screwed up. You get time off for being sick. What do you get if you're healthy all the time? You get to work extra for all your sick colleagues. What a reward. Isn't that brilliant? So you're rewarded for being sick, you're penalized for being healthy. I mean, it's polar opposite of how it ought to work. Universal coverage is a great goal, but if universal coverage means that the government's the single payer, it'll be a disaster. So what we need to do is to create a system which could be achieved by going toward electronic medical records, which would end a lot of the duplication. It would make a big difference in terms of efficiency. We would virtually pay for at least a basic coverage if we converted to electronic records and then started building in incentive-based premiums based on healthier behaviors. If you live healthier, if you present healthier characteristics, premiums are less. If you want to live recklessly, your choice, but you want to pay more.